Hello, am I audible?
Yes, ma'am.
Hello everyone, I am Dr. Sumbal Ijaz, a doctor with a strong passion for obs and gynae. I have passed MRCOG and I have been mentoring aspirants like you in their exam preparation. Along with teaching, I am also involved in medical education, research, and service design to improve patient care. So today we are diving into genetics, a topic that may seem tricky, but it is actually quite logical once you break it down. So I'm so excited to have all of you here today. But before we dive into genetics, let's take a moment. Please do let me know where are you all joining from. Like drop your city or country name in the chat box. Hello Shahrukh. Hello Amreen. Hello Adnan. Hello Sachita. How are you? How's everyone doing? Hello Dr. Shamim. I hope all of you are doing great. I know how tricky genetics can feel in MRCG Part 1 exam, but don't worry, we are going to simplify it together. So how's everyone feeling today? Like excited? Are you nervous? Let me know.
It's a very difficult topic. So
I
I feel
understand. Yeah.
I feel upset that may I can't understand it in depth.
Okay. Is there any particular topic from genetics you find the most challenging one?
Hmm. Um, that is how it is carried like X-linked and Y-linked. That was confusing to me. I read it always, but I can't retain in my memory. So maybe uh, I'm not on a perfect track to understanding in depth, na? So that's why.
Yeah, I totally understand your point. But give me a while. We will discuss the important topics from genetics. And meanwhile, I will address how you can pick different information and how you can retain in your memory and what type of important questions which come from genetics so that you can have a good grip on that particular topic. Are you
Oh,
following me?
yes.
Okay, Dr. Shamim, don't worry. We will discuss the important high yield points from genetics today. So it's just not an MRCG topic, it's a high yield area that can make or break your score. So let's break it down together in a way that makes it easy to remember. So let's begin. Okay, from genetics, let me give you a brief. It's a minor subject in your curriculum. However, the questions which comes from genetics are very selective, and if you know the answers accurately, those will become the easy marks for you. So first of all, there are different sort of questions. The one category is they just simply ask you what are the types of what is the mode of inheritance of different genetic diseases. For that, I will recommend you to know the examples of different diseases which follows a different inheritance pattern. But before we dive into the types of different diseases and their mode of inheritance, let's just know what is pedigree analysis, because mostly they will give you question regarding pedigree analysis. So what is that? Basically, pedigree analysis, just listen carefully, try to make your concepts clear. It is simply means the genetic history of a family. Pedigree analysis was developed to understand the inheritance of genes from parents to offspring. It was developed as a chart that can represent a family tree along with the family members and their genetic traits, respectively. In the simple words, it simply means that if someone is having any disease and that particular disease runs in the family, and now we want to check what is its pattern so that we can avoid that particular condition to happen in the future, or we can counsel the couples regarding that particular condition. So that was the purpose for the pedigree analysis, and it is a genetic history of a family. Another now, is everyone clear what is pedigree analysis? You can stop me anytime if you don't follow my words. If you are confused regarding anything, you can ask me anytime. So please to let me know, is everyone with me? Are you able to understand that what is pedigree analysis? Okay, so once you know what is pedigree analysis, then the second thing, whenever in your exam you will have a pedigree chart in front of you and they ask you to interpret that, by that means they are expecting from you that you know what is the pattern of inheritance of that particular disease. But before that, you should be knowing the different signs and symbols which are shown in the chart. So in order to glean useful information from a pedigree chart, the signs and symbols used to construct the chart must be properly recognized and interpreted. So this is your first task. You should be knowing all the symbols and signs from the pedigree chart. I have highlighted the important ones. The square shows the male and the circle shows the female. So whenever in the pedigree chart you see this sign, this symbol, that means they are talking about a male. And if you see a circle, that means they are talking about the female. If that is bold, the circle, that means this is affected female. And if there is a square, that means it is affected male. The another thing which is important is this dot sign, which shows the carrier state. So if by any chance, if you're not able to remember all of the symbols, so these are very important. You cannot afford to miss these ones, because if you don't know these symbols, you cannot interpret any pedigree chart. Am I clear? Okay, so we are going into the sequence. First of all, we understand that what is pedigree analysis, which is the genetic history of a family. Second thing, what is pedigree chart and how it shows and how we can interpret different symbols from the chart. Once you know this, then there is your next step, in which now this is the time you should be knowing the different types of genetic disorders. So this is your third step. So classically, there are three different categories of genetic disorders. Again, genetic disorders are the disorders which runs in the genes, which runs in the families. So there are different types of pattern. One category is autosomal type, in which we have further two categories: autosomal dominant, autosomal recessive. The second category is sex-linked, which could be X-linked to dominant, X-linked recessive, and the third one is mitochondrial. Okay, anyone have any idea what is autosomal? What does this word mean? Okay, please tell me how many number of chromosomes are there in the humans? Yes, that's excellent, 23 pairs. And total number is 46 chromosomes. Yes, so the autosomal chromosomes are the 22 chromosomes which are not related to the sex, which are not sex determining chromosomes. So these are the defects in the autosomal chromosomes, which are your 22 pairs of chromosomes, and it could be dominant and it could be recessive. And I will break this down. What does dominant means and what does recessive means? The second category we have sex linked. So what comes into your mind when I'm talking about the sex linked genetic disorder? Where this condition is lying? Okay, I'm not asking about the example. Okay, Dr. Shamim, please make yourself correct. Okay, there is a difference. Let me clear myself. There are two types of disorders. One are the genetic disorders and one are the chromosomal disorders. When we talk about the chromosomal disorders, that is entirely something different, in which we classically talk about the absence, presence, mislocation, dislocation, insertion, or elimination of different types of chromosomes, in which we have different examples like Turner syndrome, Down syndrome, Edwards syndrome, Patau syndrome. But when we are talking about the genetic disorders, we classically talk about the genes dislocation, the gene variation, which are running in the chromosomes and which runs in the family. So please don't mix the two conditions. Is everyone following me? What is the difference between genetic disorders and chromosomal disorders? Or do I need to repeat this thing? So one more time, we have whenever we are when we are studying genetics, please make yourself oriented in such a way that you don't make some silly mistakes. This is a very I have seen this trend. Some students, they usually mix these two conditions. They mix chromosomal disorders with genetic disorders. They are entirely different thing. When we are talking about genetic disorders, we are talking about the genes pattern which runs in the family. But when we are talking about the chromosomal abnormalities, there are different categories like triploidy, aneuploidy. That means there is a presence of extra chromosome or the absence of a chromosome, in which we have different examples like Down syndrome, Edwards syndrome, Patau syndrome, Turner syndrome, or Klinefelter syndrome. For now, okay, we were at sex linked. That means they are the disorders which are relevant to the sex chromosomes, classically X chromosome. Yes, Kashif, that's a wonderful answer. Genes is a specific locus on a chromosome. Dr. Saima, are you clear now? Dr. Shahrukh, are you clear? Okay, another thing I want to highlight here, in your exam, they will maybe ask you question from the genetic disorder, or they maybe ask you question from the chromosomal disorder. So there are some, today we are classically focusing on the genetic disorders, and I will tell you what are the highly repeated questions, what are the high yield topics, and what are the high yield points. But when it comes, there are many other lectures on the chromosomal disorders as well, and I will tell you in chromosomal disorders what are the high yield points and what are the repeatedly questions in the exam. Okay, now let's begin from the autosomal dominant inheritance pattern. What I usually recommend whenever you have you encountered a question from the pedigree analysis, what you should do in steps. First of all, from the clinical from your question, try to identify the inheritance pattern. Try to identify the disease. For instance, these are the examples for the conditions which follows autosomal dominant pattern. For instance, if in your question they are talking about Marfan syndrome, for instance, and now you already know the Marfan syndrome is an autosomal dominant condition. So One thing you need to identify the particular disease follows which type of inheritance pattern. One thing, and the second step is you need to remember this rule. I have tried my best to simplify this topic. This rule is 50-50 rules, 50-50 rule. What does that mean? 50% are affected and 50% are normal, and there are no carriers in the autosomal dominant state. Dominant means only one affected gene is enough to cause a condition. So that's why, since only one gene, if a male boy, if a male have X and Y gene, and he had some sort of mutation on maybe, okay, this is more relevant for the X-linked conditions, but try to understand in the autosomal chromosomes, if there is only one defective gene is there, that is enough to cause the condition. So that's why this is a key point that in autosomal dominant condition or whatever the dominant condition is there could be no carrier state. And the reason behind is that only one defective gene is enough to cause the condition. So again, let me recap. Uh, let's imagine you have a question in front of you, and now for instance, they are talking about Marfan syndrome, and now you already know the examples. So you already know this is an autosomal dominant condition, and the second thing that comes to your mind is the 50-50 rule. Now you know the two things, and now go and look into the options, what exactly they are asking about. They might ask you, what is the probability of the child who are affected? So you already know the 50% is the answer. And if they are asking about how many probability is there for the normal child, then you already know from your formula that 50% would be normal. So now think yourself, is that really difficult topic? This is how you can easily interpret any pedigree analysis. Okay, is everyone clear regarding autosomal dominant? Now, if any time, if you have got any question from the autosomal dominant inheritance pattern, you know the rules, the 50-50 rule. And your job is to memorize the examples. Try to remember the important ones. It's okay if you don't know all the examples. I will tell you a trick to remember the table as well in the end. Okay, let me tell you, Dr. Kashif. Okay, so in autosomal dominant conditions, classically, the conditions which have some structural problems, they are autosomal dominant. For example, if you look at achondroplasia, it has some in achondroplasia, the baby born with short arms, short legs, so it is a structural abnormality. So generically, the conditions which have to do something with structural abnormality, they are autosomal dominant. So it would give you a hint. With a few exceptions, I will tell you what are the exceptional conditions. And if you look at other conditions like Ehlers-Danlos syndrome, hereditary hemorrhagic telangiectasia, hereditary spherocytosis. This is the most favorite question from the MRCG-1 curriculum, because hereditary spherocytosis, it seems like a metabolic defect because it happens at the RBCs level on the membrane of the RBCs, but it is a structural problem. There is a problem with the a protein kinase maybe of the RBCs, which leads to the spherocytosis of the RBCs. So it is an autosomal dominant condition, please remember. Hereditary spherocytosis is not autosomal recessive, it is autosomal dominant. Then HNPC, Huntington's disease, Marfan syndrome, Noonan syndrome, neurofibromatosis, osteogenesis imperfecta, all of these, retinoblastoma, all of these, tuberous sclerosis, all of these have structural problems, so they are easy to pick, they are autosomal dominant. Am I clear? And the two exceptions you need to know is one is hereditary spherocytosis, and the second one is von Willebrand's disease. So these two conditions from hematology, it seems like they have some metabolic defect, but actually they are structural. They falls in the category of structural defect. If you have a pen and a paper, please, you may note it down that hereditary spherocytosis and von Willebrand's disease are exceptionally autosomal dominant conditions. And in MRCG Part 1 exam, they love to ask questions from the exceptional points. So is everyone clear regarding autosomal dominant conditions so that we can move on to the autosomal recessive?
Excuse me.
Yes.
What you telling about hereditary spherocytosis? I'm not picking it.
Okay. What I was trying to explain, in autosomal dominant conditions, and it has to do something with the structural defect, like the conditions which affect structurally, they falls into the category of autosomal dominant conditions. With the exceptions of hereditary spherocytosis and von Willebrand's disease, because these two conditions they are not apparently looks like they lead to any structural defect. In contrast to that, they seems like there are some metabolic defect going on, but they falls in the category of autosomal dominant condition. Are you clear now? Okay, let's move on to the autosomal recessive condition. Again, the way is similar. Whenever you get a question in your exam, try to identify the condition from your memory that in which category it falls. For instance, if they have given you the scenario of hemochromatosis, now you know from the examples that it follows the autosomal recessive pattern. You are halfway there into your diagnosis. The second thing, one way they may simply ask you what is the mode of inheritance of this particular condition, and you know the answer, autosomal recessive. The second category would be they ask you to interpret the pedigree. Now the rule for autosomal recessive is 25, 50, 25. What does that mean? All of these conditions which are listed here, which follows the autosomal recessive pattern, they shows 25% normal, 50% carrier, and 25% affected. So now in your question, if they are asking about hemochromatosis and they ask you what is the probability of this child to be normal. So what could be answer, please? Look at the screen and answer my question. The question is regarding hemochromatosis, and they are asking about what is the probability of the child of this couple, which is going to be normal. Excellent, Dr. Kashif and Dr. Shamim. Yes, 25%. And what if they ask how many children are going to be normal?
25%.
Yes, excellent. And what about the normal ones?
Normal one, 50%.
Yes, excellent. And how many it could be the affected or have the disease?
25%.
Yes, excellent. So this is the formula. You just remember the rule 25, 50, 25. That's it. Again, your job is to remember the disease, the conditions, and then put this formula and you will interpret any pedigree analysis. Okay, another difference, now look at the difference between autosomal dominant and recessive. In autosomal dominant, we have discussed that there would be no carrier state. Why? Because that is a dominant condition. But now in recessive, we have carrier state. Since it has the carrier state, it can skip generation. Both males and females are equally affected because this is an autosomal inheritance. Affects individuals can have unaffected parents because of the carrier state. So if you look at this chart, this is a very simple diagram. Okay, what do you think? These two are affected or carrier parents?
Carrier?
Yes, both of these are carriers. And now, if you don't understand if you forget the concept, if you don't understand the inheritance pattern, but you remember the rule, that's enough for you to pass the exam. For instance, if you have no clue over here, but you know 25, 50, 25. So here you can see 25% are normal, 50% are carrier, and 25% are affected. So the rule is similar. You can implement this anywhere. I hope now this makes sense to you. Is everyone with me? Okay. Another thing for autosomal recessive conditions, as I have discussed, in autosomal dominant conditions, they have to do something with the structural problems. In autosomal recessive, they have some problem at the metabolic level. For instance, if you can see here with some examples, glycogen storage disease, it is a metabolic defect. Hemochromatosis, it is an iron metabolic defect. Homocystinuria is amino acid lipid storage disease. Then we have Wilson disease. So albinism. So all of these are occurring at the molecular level or at the metabolic level. So this is how you can, in a very broad way, you can segregate the examples. For instance, if you have no clue, you don't remember the examples, but on the basis of your common sense or the background knowledge, or just by simply understanding, is it a metabolic defect or it is a structural defect, you can segregate the examples. Now, let's move on to the X-linked dominant. Now we are into the sex genes. Uh, the rule is similar, like in dominant conditions, there is no carrier state, so does in X-linked dominant. So there could be no carrier state and it appears in every generation. Both males and females can be affected, but females are more frequently affected. Affected fathers pass the trait to all their daughters, but not to sons. And this is the tricky part here. Although the dominant inheritance is quite simple to interpret, but since it is X-linked, now think logically. We have discussed that the dominant condition, only one defective gene is enough to cause the condition. And let's imagine the father. In these particular conditions, you need to look at the parents carefully. Is the father is passing the condition or the mother is passing the condition? Because if the father is affected, now try to think logically. The father has XY chromosome, and this is the X-linked chromosome dominant condition. And the mother has double X chromosome, which is absolutely normal. So what do you think, what could be the probability of the condition? How it could be inherited to the offsprings? Let me repeat my question. I'm asking about if the father is affected and the mother is normal, so what could be the probability in their children? Okay, tell
Daughter
me the
100%,
Yes, excellent. And what about son?
son normal 100%,
Why it is normal?
because they gain Y chromosome from father.
Yes, excellent. So this is the trickiest part here. Whenever you are interpreting pedigree, try to look at such things as well. So, for instance, if you just have a blank pedigree analysis and now you want and they ask you to interpret that, so try to look out these things as well. Humaira, we are talking about X-linked dominant conditions, so there would be no carrier state. Please, in dominant conditions, there could be no carrier state. The daughters would be 100% affected. Okay, then we have X-linked recessive, and this is highly asked in the previous exams. The examples from X-linked recessive conditions, please remember these carefully. Duchenne muscular dystrophy, they love to ask question from here. Then glucose 6-phosphate dehydrogenase deficiency, hemophilia, neurogenic diabetes, Leishman syndrome, gamma globulinemia. So these are the examples from X-linked recessive conditions. The rule to remember is 25, 25, 50. Again, we are going in the similar way. First of all, you need to identify the condition from the scenario. If, for instance, they are talking about Duchenne muscular dystrophy, a couple came and you are there for their genetic counseling. So they are talking about Duchenne muscular dystrophy. Now, with your memory, you know it is X-linked recessive condition. And now they are asking about what is the probability of their child to have this condition in the future. So your rule is 25, 25, 50. That means 25% would be affected, 25 would be carrier, and 50% would be normal. That is different from autosomal recessive condition. So whatever the condition they gave from this list, your formula would be similar. It is more common in males. Males only need one copy of the gene to be affected, while females need two. So mostly X-linked recessive conditions are inherited to the male child. Affected males are usually born to carrier mothers, cannot be passed from father to the son. Each male child of heterozygous female carrier has a 50% chance of being affected, whilst each female child of a heterozygous female carrier has a 50% chance of a carrier. So if they have more particularly asked about the gender, if they are into the gender specification, then your percentage would be different. However, in a nutshell, if they are just simply asking you what could be the inheritance pattern, you need to follow this formula. 25% affected, 25% carrier, and 50% would be normal. Okay, so is everyone ready to start the SPA practice? If anyone have any questions, you may ask. Okay, Amrit, exactly which point you want me to repeat? Autosomal recessive or autosomal dominant? Okay, the last slide. Okay, we were talking about X-linked recessive condition. Since it is a recessive condition, so it may have carrier state. The one thing which you need to remember are the examples like Duchenne muscular dystrophy, glucose 6-phosphate dehydrogenase deficiency, hemophilia. So these are the three conditions they mostly test in your exam. Then the formula, which is 25, 25, 50 rule. That means in the X-linked recessive conditions, the 25% would be affected, 25% would be carrier, which is opposite to the autosomal recessive conditions, and 50% would be normal. And it is more common in the males. Why? Because it is yes.
Fragile X syndrome is X-linked recessive or dominant?
Basically, it is X-linked dominant. It is a typo mistake here. I have noticed that. I will edit this later on. Thanks for highlighting this.
Thank you, ma'am.
It is X-linked dominant. Okay, so the formula is, you need to remember the formula, which is 25, 25, 50. 25% affected, 25% carrier, and 50% normal. So it can be implemented on any of the conditions listed here. And then there is an extra point here. If in the exam they are simply asking about what is the probability of affected child, you know your answer. If they are asking about the probability of carrier, generally you know your answer. And what could be normal, your answer is here. But yes, if they are more particularly asking about the gender specification, then you need to just look at the percentages here. For each male child of a heterozygous female, that means a carrier female has a 50% chance of being affected, whilst each female child of a heterozygous female has a carrier of 50% chance. So here in this picture, this is the X-linked recessive pattern in which the father is unaffected and the mother is carrier. Now you can see again the formula which I have listed, which I have mentioned here. We have 25% affected. We have 50% unaffected, 25% carrier, and 25% affected. And mostly the son is the affected one. Is everyone clear now? Generally, in a nutshell, whenever it comes to the X-linked recessive condition, you just try to quickly jump onto the males, because male are more prone to having this condition. Okay, so are you ready now? So here is your first question. Which one of the following is not inherited in an autosomal recessive fashion? That's excellent. A is the right answer. Achondroplasia is inherited in an autosomal dominant fashion. Again, autosomal condition inherited conditions often cause structural problems, whereas autosomal recessive tend to cause metabolic or enzyme defect. Exception to this generalization include ataxia telangiectasia and Friedreich's ataxia, which although involve a structural problem, are in fact autosomal recessive. So I'm showing you the demo. One category of question in your exam could be like this. These are the simplest question which comes from genetics. Your next question is, which one of the following is not an autosomal dominant condition? Dr. Kashif, I don't accept the answers with the question mark at the end. Be confident and be sure on your answers. Okay, for those who gave me the answer C, okay, there's only one, Dr. Sadia. Hereditary non-polyposis colorectal carcinoma. Do you have any idea what could be there in this condition? Very well done, everyone. Hemochromatosis is the right answer. Hemochromatosis is an autosomal recessive condition because it has to do something with a metabolic defect involving iron. So again, here is a list of autosomal dominant conditions and autosomal recessive conditions. You might later on revise this table for your quick revision. For instance, you are practicing questions from anywhere of genetics and you're not sure about the condition from which category, from where it comes from, you just quickly look at this table and you're halfway there. And literally, I understand being a student is a difficult job, but more you revise, the more you retain. Revising is the strategy, is the key to pass the exam. So more you revise, it's okay if you don't know the answer. That's absolutely fine because now you are in the learning phase, and the more mistakes you made, the more you will learn. Whenever, don't worry if you don't know the right answer, just go and look at the table and revise the conditions. That's it. And the more you revise, the more you will retain. And there's a point come near to your exam, you have these conditions on your fingertips. Am I clear? Okay, now here is your difficult question. For presentation below, choose the most likely mode of inheritance. Now take your time and try to interpret this pedigree chart. Yes, Dr. Kashif, there are many mnemonics. You can simply look at the YouTube or the Google. They will provide you with many mnemonics, or if you don't want to do that, we can share that. We will share the mnemonics in the WhatsApp group. Okay, I need a volunteer to explain this question.
It's X-linked dominant.
Okay, how did you interpret that? Help your colleagues as well.
At first, father is affected. It gives
Okay,
disease to all daughters
okay,
because X damaged chromosome goes to all daughters. Then in the next generation, daughter is affected, which give
mm-hmm.
X defected to her son and daughter.
Okay, that's
And in
brilliant.
third generation, father give defected X chromosome to her daughter. Last one.
Okay, that's brilliant. And yes, B is the right answer. That means you are now
Thank you.
have good expertise in genetics. That's really impressive. All of you are quick learner. Everyone's answer is right. Here's a detailed explanation. For those who couldn't able to interpret that pedigree chart, don't worry. An autosomal dominant inheritance only one copy of a disease allele on the X chromosome. Sorry, it is X-linked dominant. Here's a typo mistake again. Only one copy of a disease allele on the X chromosome is required for an individual to be susceptible to an X-linked dominant disease. That means only again, in any dominant conditions, only one dominant gene is enough to cause the condition. Pattern of X-linked dominant inheritance is that when a female is affected, each pregnancy will have a 50% chance of offspring to inherit this disease. When male is affected, all his daughters will be affected, but none of his sons will be affected as shown in this diagram. Okay, Dr. Kashif, here is that chart. In other words, this is a summary. No male-to-male transmission. As you can see here, there is no male-to-male transmission is going on here. All daughters of a male who has the trait will also have the trait. Sons can have the trait only if their mother also has the trait, which is classically exhibited in this chart. Is everyone clear now?
Is it autosomal dominant or X-linked dominant?
It is X-linked dominant. I have mentioned that here is a typo mistake. It is an X-linked dominant condition. Let me correct here so that it would not lead to any confusion.
X-linked dominant.
Are you clear now?
Yeah. X-linked dominant now.
Yeah.
Now it's okay.
Okay, clear? Should we move on to the next question? Okay, two parents who are both carriers of cystic fibrosis would like to know their chances of their offspring losing the gene for cystic fibrosis. What is the probability that will have a child that is not a carrier nor affected by the disease? Try to make sure it reflects here. Okay, my question is, what mode of inheritance does the cystic fibrosis follows? Answer my question in the chat box. What type of inheritance cystic fibrosis follows? Yes, excellent. It is autosomal recessive. Now write down the formula which I have teach you for the autosomal recessive inheritance. Okay, 25, 50, 25. What does that 25, 50, and 25 means?
25% normal, 50% carriers, 25% affected.
Yes,
And they are
excellent. Yes, so C, 25% is the right answer. So now you can see, now you can implement this thing on any condition which comes from autosomal recessive pattern. So this is how simple it is. So cystic fibrosis is the commonest autosomal recessive condition in the UK, and it is due to recessive defect in the CFTR gene on chromosome number 7. Recessive genetic disorders occurs when both parents are carrier and each contributes the recessive allele to the embryo. As both parents are heterozygous for the disorder, the chances of both affected alleles passing to the one of the children is 25%. 50% of all children are carrier and 25% will escape inheriting the gene. Is everyone clear? So here's your next question. Prospective parents, dad is completely unaffected but mom is a carrier, come to see you in your surgery for a chat about the chances of their children inheriting Duchenne's muscular dystrophy. So the chances of completely unaffected children, neither clinically affected nor a carrier, would be
50% ये autosomal recessive है ना? लग रहा है
okay. So what is Duchenne muscular dystrophy? Which inheritance pattern it follows? Answer me.
Autosomal
X-linked
recessive.
recessive.
Yes,
X-linked.
it is X-linked recessive and it is highly tested in the exam. Cystic fibrosis is the MRCOG-1's favorite topic from autosomal recessive and Duchenne muscular dystrophy from X-linked recessive. They love to ask questions from these conditions. Now, what was your formula for X-linked recessive conditions?
And 25% diseased, 25% carrier, 50% normal.
60%
Yes,
normal.
so what would be your answer here?
E.
Yes,
50%.
so this is your 50%. And literally, you can implement this formula on any condition which are listed in X-linked recessive condition. So now what do you think, where do you stand in genetics now when it comes to the pedigree analysis? Here we have covered some key genetic concepts today, but there's so much more to MRCG Part 1. And if you want to have structured high yield preparation with expert guidance, I invite you to join Med Institute's premium MRCG Part 1 course. We designed to help you master all exam topics with clarity and confidence. And this course isn't just about the lectures. Basically, it's complete study system that ensures you are well prepared for the exam with structured learning and practice. And all of our students have successfully passed using these techniques. And we have consecutive 100% result in previous batches of MRCG Part 1 exam. So it's a big deal. So if you are serious about passing MRCG Part 1 exam and want a well-structured study plan, enroll now. You can find the details here. If you want to enroll yourself, you can message here for the queries. Seats are limited, so don't miss out. And for those who are joining today, we are offering an exclusively early bird discount, but only for limited time. So if you are ready to take your MRCOG prep to the next level, now's the perfect time to join. Let me give you an idea what is includes in our MRCG-1 premium course. It comprehensive coverage of the MRCG Part 1 syllabus, like we have an organized module from which is derived from the RCG curriculum. We have made a very organized study plan in which we will provide you with a daily task. And we classically focused on the high yield topics. We follow the exam focused strategies and high yield concepts. We provide with exclusive study material and practice questions which are available on our website, and we also conduct daily Telegram group discussion. So there would be live interactive sessions as well, and there would be 24/7 question and answer support. And once you are done with each module, we also conduct mock exams. So here's the package for the comprehensive MRCOG Part 1 exam preparation. Yes, Dr. Kashif, I'm hoping on that. Okay, for those who are interested in our premium course, let me give you a brief again, how we are going to study for MRCG Part 1 exam in a strategic way. And this also helps you if you are studying by yourself. So one thing, as I have mentioned earlier, the revision is to key to pass this exam, right? So the more you revise, the more you will retain the information. So what we usually do with our premium students, how we study together, we have segregated all the modules separately, like anatomy, physiology, endocrinology, each and every module. And once we pick one module, we will give the task to our students on the daily basis that study this topic from the theory. We conduct the live sessions so that their concepts would be clear. Then on the daily basis, we have a Telegram group discussion in which we discuss all the important SBAs relevant to that particular topic. And once you're done with the module, we conduct each mock exam for each module separately. At the same time, we have an extensive question pool on our website. You can practice anytime according to your facility. You can practice anywhere, anytime. The questions on the website, we have segregated recalls as well. For instance, if you are studying anatomy and you just want to go through from the recalls of anatomy, we have a separate portion for that. So this way, you will revise 3 to 4 times each module while following the course. And literally, if you revise the curriculum this many times, nobody can stop you passing the exam. And that's the reason why our previous batches have shown the 100% result. Is everyone with me?
Yeah.
Okay, I tried my best to make genetics simplify as much as I can. I hope this would be beneficial for you. If you have any question, any doubts, and if you have any query regarding the enrollment in the course, you can contact our backend team and at any time. So these are the details. There is a WhatsApp number, Facebook page, and email address. You can contact here. Thank you, Dr. Kashif. And literally, there are just two categories of genetics which comes in the exam. One is from the genetic disorders, and other one is from the chromosomal disorders. And now we are done with the genetic disorders, and I don't think so. Is there anything is left from this topic? Now, the second topic which is left is your chromosomal disorders, in which we have Down syndrome, Turner, Klinefelter, Edward, and Patau syndrome. That's it. That's all from the genetics. And another thing, we doctors have a very busy schedule, and we also have some family commitments, some personal commitments. So please don't delay your exam preparation. Start preparing for the exam as soon as possible, because the RCOG is very unpredictable.
Why it is unpredictable? I don't understand this comment.
Okay, it is unpredictable in a way that sometimes they have provided clear percentages regarding each module. For instance, according to their percentage values, they put more emphasis on anatomy, endocrinology, clinical interpretation, data interpretation, clinical management, and some are the minor topics like genetics, biophysics, biostats. But in the exam, sometimes they give more and more questions from these minor subjects.
Okay.
So this is how it is sometimes unpredictable.
Okay.
So each and every module is important. Even if it is a genetics, there might be only 3 to 4 questions are coming from genetics, but they hold a huge significance, because you never know. They will give you 10 questions from genetics. It happens with me when I was writing my exam. I was thinking biostats is the pioneer subject, but I got 8 to 10 questions from biostats.
Yeah.
So this happened with me.
Okay. Do you think that 3 months are sufficient to prepare MRCOG Part 1, as all of us are in our practices as well, and this senior in age group? So what you suggest for?
Okay, it depends how many hours in a day you can manage for studies. So do you have any idea, like 3 hours, 4 hours, 1 hour? How much time did you have?
As I can't calculate because of my emergency cases and I stuck there. So I have a telephone, mobile in my hand, and I many time I try my best to learn more and more. Some questions or some topics, especially Oxford Revision Guide. I try myself. I read it many times. So, like one
Okay.
sitting is very difficult, but trying.
Yeah, more power to you. You seems like a very hardworking person.
Yeah.
Yeah. Okay. With your routine, for the candidates who are working as well as they are studying, I recommend them to start preparation as soon as possible because you never know whenever you have emergencies. One day you are studying for 4 hours, and for the next 2 days you have no time for studies, right?
For
This
no
thing
time to
happens.
study. Yeah.
Yeah.
I have 3 to 4 cases emergency, so I can't. So I
Yeah,
try.
I totally understand. This happens. So that's why I would recommend you to start preparation as soon as possible.
Okay. Okay, inshallah.
Sure. Do we have any other questions? Any queries? Thank you so much, everyone, for joining us today and for bearing with me so far. Best of luck. See you soon in the next session. Goodbye.